Hello, welcome back to Healing Oracle. I'm Robert J. Morris, and this is your source for maintaining and restoring health and preventative measures against illness. In today's installment, Mary will talk to us about the importance of the hormone known as vitamin D3, what to look for, dosage misconceptions, and much more on the subject. For a transcript and links to sources, please check the description below. Now, here's Mary.
I'd like to talk about vitamin D today. Vitamin D has been very underestimated and could actually not only extend your life but save your life. However, not if you're to follow the misguided information we see regurgitated many times deriving from the RDA guidelines. I first started to write about vitamin D, it was about 5 years ago. That was when 400 IU was considered the maximum safe dose. And the medical mafia raged against researchers like me who clearly identified beyond reasonable doubt that people required significantly more vitamin D3. Not only that, but when using high doses of D3, the result often proved nothing short of miraculous in treating and curing a wide variety of health conditions. But let's forward to today. It's only now, years later, and for many, unfortunately, just a little too late, that the so-called medical establishment has changed their guidelines. Many people are seeing this when visiting their own local MD or doctor, whom are recommending you take doses in excess of 400 IU. Now, isn't that strange from just 5 years ago? But there's a lot of controversy surrounding the question of how much to take. The controversy continues, and I just don't know when this is going to end. Measuring vitamin D3. This can only be done by taking a simple blood test, and the blood test needs to go for analysis. Everyone absorbs vitamin D differently, but what matters is how much vitamin D we have disposable, not how much vitamin D we actually take. So, it's time to take control over your own health and find out how much disposable vitamin D you have. I actually advise everyone to ask the doctor, MD, to order a 25 hydroxyvitamin D test to see how much usable vitamin D you have in your blood system. Many doctors mistakenly aim for vitamin D levels in the 20 to 30 nanogram per milliliter, that's NG range. Vitamin D experts believe and conclude that our bodies need up to 90% more of that recommendation in order to prevent sickness and disease, and I 100% agree with this. These days, maybe most doctors would consider 40 nanograms normal and perfectly safe, but you can actually go much higher without danger. Have you ever known anyone to have toxicity from sun exposure? I think not. So let's think about this. The sun provides a natural source of vitamin D without toxicity. Now, is it making sense now? It should be. There's a doctor by the name of Lucinda Messner, a naturopathic doctor who was interviewed, stated there's no danger of vitamin D toxicity in an adult until 160 nanogram level. And such a high level is nearly unheard of. Actually, I've never heard of it myself. Anyway, she tested vitamin D levels in thousands of patients and found that 160 plus level in only one patient, surprisingly enough. Nearly everyone she ever tested was in the 10s, 20s or 30s. She rarely encounters anyone over 40, and people with that level are nearly always taking 1,000 IU minimum to supplement. She believes cancer patients and should aim for vitamin D blood level of 90 to 100 milligrams. In short, virtually no one is anywhere near a toxic level of vitamin D. On the contrary, nearly all of us are severely deficient, so that's what we need to think about. Dr. Messner is an author of a book called Powerful Medicine, Shedding Light on Worldwide Health Crisis. You can check her out and her detailed recommendations for vitamin D supplementation for cancer patients, although the book was written in 2003 and she says it's in need of updating. Dr. Mesner advises if you have cancer or heart disease, you want to be in the therapeutic 70 to 100 nanogram range. I agree with her in principle, but I would even add higher doses of vitamin D, and I've seen the advantages of this time and time again. So what can vitamin D do for you? Practically everything. Vitamin D drastically decreases your risk of serious illness, including but not limited to autoimmune disease, heart disease, cancer and diabetes, just to name a few. It also deals with the real blow of chronic inflammation, which is implicated in nearly every chronic disease. And if that weren't enough, vitamin D also improves muscle function. It keeps your immune system healthy. It balances your insulin and phosphorus levels and helps you absorb calcium, thereby keeping your bones strong and preventing fractures. Now, we've all heard the myth of vitamin D toxicity. Why do some say that vitamin D could harm you? Let's have a look at this. In the 1930s, European countries started to fortify foods with vitamin D, which was then believed to be the miracle vitamin. But 20 years later, when British children had too much calcium in their blood, doctors mistakenly blamed vitamin D without looking deeper. During the 1980s, doctors in India treated tuberculosis patients with 3,800 IU of vitamin D daily for 3 months. Their patients developed dangerously high levels of calcium. So what did they do? They just blamed the vitamin D. This all led the US government to declare that 1,000 IU of vitamin D daily could be toxic. But they forgot that excessively high calcium levels are common in tuberculosis patients. Perhaps it wasn't vitamin D's fault after all. I don't think there was any perhaps about it. Finally, in 1999, Dr. Reinhold Veith, a University of Toronto researcher, conducted a study showing that 10,000 IU of vitamin D daily appeared safe. Whilst that may sound high, it's what you'd get if sat in a bathing suit in July for just 15 minutes without sunscreen. Has this ever been a problem? Let's think about this. Sitting in the sun for 15 minutes in a swimsuit, just 15 minutes? I don't think so. Common sense should prevail here. Today, the Institute of Medicine recommends 600 IU daily for healthy bones. Dr. Heaney of the University of Omaha and Michael Holick, Boston Medical Center, recommends 1,000 to 3,000 IU daily. The Endocrine Society says infants need 400 to 1,000 IU. Children and teens need 600 to 1,000 IU. And adults 1,500 to 2,000 IU. Some studies contradict this good news. To complicate matters, a recent study published in the Lancet Diabetes and Endocrinology seems to suggest that vitamin D has no benefit or positive effect on bone density. Vitamin D helped none of the 32 women in the trial to reduce their MI, stroke, cancer or hip fracture. The study led author Dr. Mark Boland from the University of Auckland in New Zealand said that there is little justification currently for prescribing vitamin D to prevent heart attack, stroke, cancer, fracture or otherwise in healthy people. A study of just 32 women is considered rather small, don't you think? Did this actually display anything? Well, the test was only done on 32 people, so again, think about this. On the other end of the spectrum, Dr. Cedric Garland, the University of California, San Diego, says colon cancer cases could be cut in half if people took just 2000 IU of vitamin D daily, and breast cancer cases could also be cut in half if women took 3000 IU of vitamin D daily. Dr. Garland is a long-time enthusiast of vitamin D. Personally, I take 30,000 IU of vitamin D daily, and I still have lower vitamin D levels than the therapeutic target range. I had started to take 50,000 IU daily for a 2-week period prior to reducing the dose to 30,000 IU. So who is right? Vitamin D protects you from getting colds and flus, it strengthens your bones and muscles, and it lowers the risk of cancer. So why do few researchers still insist vitamin D does not reduce the risk of heart attack, stroke, cancer or bone fractures? Well, there's 2 reasons. Some poorly informed doctors still prescribe vitamin D2. Now this is very important. D2 is harder for your body to absorb and less effective than vitamin D3. Vitamin D3 is what you get from the sun, not vitamin D2. Take note, folks. Most researchers use 400 to 800 IU a day in their studies, but this amount is just too small to be effective, and it's not clinically relevant. A study published in the American Journal of Clinical Nutrition in 2007 used higher dose amounts of vitamin D with great success. So this goes to show a higher dose, you'll see the success rate. The lower dose just simply is not enough. During the 4-year study, women who take 1000 IU of vitamin D and 1450 IU of calcium daily were 77% less likely to be diagnosed with cancer. Go figure, 77% people, what is that telling you? When doctors gave Japanese school children 1200 IU of vitamin D3 daily, the children were 42% less likely to get the flu and 83% less likely to suffer from asthma attacks than those who received the placebo pills. So go figure, use common sense here, people, again. As I've previously stated, we are all individuals, and as such, we absorb vitamin D differently. What matters is how much vitamin D we have at our disposal, not how much we actually take. As I said, a simple blood test will reveal your disposable vitamin D, and this is how to calculate how much your body actually needs. So how to boost your vitamin D? First and foremost, we look at naturally. And the natural source of vitamin D3 is in the sun. So, sitting in the sun for just 20 minutes during the summer in a bathing suit without sunscreen will give you the best quality vitamin D. And from what I learn, there is no danger of toxicity from vitamin D your own body makes when exposed to the sunlight. But you may not have much choice but to take oral supplementation in the winter months, depending on the climate of your chosen country of residence. Make sure you choose vitamin D3. Do not get this confused with vitamin D2. Vitamin D2 is what's used in fortifying milk and some other foods. Also, make sure you take vitamin K2 always with vitamin D to keep calcium from building up in your arteries and soft tissue. Whilst the dose is argued, you can simply continue getting healthier. Some people believe the vitamin D controversy will end once and for all when a current large-scale study called VITAL releases its findings in 2017. Given the medical establishment's knack of manipulation such studies, I'm not very confident. I'll certainly review those findings when they come, but there's little doubt in my mind that vitamin D3 plays a huge role in boosting your body's immune system and the ability to fight cancer and other disease naturally. and the importance of clean vitamin D. It's proving increasingly impossible to find a pure source of vitamins and minerals nowadays. Vitamin D3 is no exception. I was trawling through the internet researching where to purchase a clean, pure vitamin D. To my horror, over 90% of vitamin D3 now contains magnesium stearate. Magnesium stearate actually blocks the stomach's absorption of any vitamin or mineral. I've written the full skinny on this, and I'm going to provide the link. Vitamin D3, all as you actually need is the vitamin D and olive oil, cold pressed organic, to suspend it in. It's very, very simple, people, but they seem to want to block the vitamin D. Why is this? Why would they want to stop us taking vitamin D? Let's think about it. Vitamin D, like I said, can stop illness. It's preventative as well as a cure. So what we have to think about is how much vitamin D, let's conclude, how much vitamin D our bodies actually need. Well, that depends on the individual. As I said, do take the test. It's no point keep popping the pills if you don't know what your vitamin D level is. Thank you for listening, and I hope we're all more educated with vitamin D. Thank you.
Thank you, Mary. And don't forget about our upcoming seminar on taking control of your health in Orlando, Florida on February 13th. Details will be provided in the description below. Thanks for watching, and this has been Healing Oracle.